An eating disorder is not usually a phase, and it is not necessarily indicative of madness. It is quite maddening, granted, not only for the loved ones of the eating disordered person, but also for the person herself. It is, at the most basic level, a bundle of contradictions, a desire for power that strips you of all power, a gesture of strength that divests you of strength, a wish to prove that you need nothing, that you have no human hungers, which turns on itself and becomes a searing need for the hunger itself. It is an attempt to find an identity, but ultimately it strips you of any sense of yourself. It is a grotesque mockery of cultural standards of beauty that ends up mocking no one more than you. It is a protest against cultural stereotypes of women that in the end make you seem the weakest, the most needy, and neurotic of all women. It is the thing you believe is keeping you safe, alive, contained, and in the end, of course, you find it is doing quite the opposite. This quote from Wasted, a memoir of anorexia and bulimia, accurately captures the distress that eating disorders cause. Anorexia-Nervosa is a very serious eating disorder affecting 1/10 of United States citizens. Characterized by extreme weight loss of more than 15% of normal body weight, obsession with weight loss, and intense fear of gaining weight, anorexia-nervosa can be fatal. It creates extremely aversive physiological effects on the anoretic, such as cardiac failure, organ failure, malnutrition, lack of fertility, or suicide. Anorexia is not only detrimental to the individual's physical and mental health, but it hurts the relationships with loved ones, leaving the anoretic alone and feeling out of control. The implications of anorexia create a vicious cycle of control and loneliness that is almost impossible to overcome. Anorexia is caused by a hodgepodge of factors. Those at risk for forming this disorder follow the triple vulnerability thesis. The most potent biological risk factor is being female. 90% of anoretics in the United States are female. They are those perfect girls, the ones who are always successful, in control, and competitive. They are the girls that everyone strives to be, the role models, the ones who embody effortless perfection. People with eating disorders tend to be both competitive and intelligent. They're incredibly perfectionistic, excelling in everything they do. They embody everything that control and perfect mean. What kind of grades did you get before the onset of anorexia?
I was a straight A student, honor roll, president of the National Honor Society. I studied hard, but I made it look like I didn't.
It must have been hard to seem perfect all the time. What about sports? Did you play any?
I ran cross country, I swam, and I danced, and I was the best in every one of those. I always won our cross country races, and I had a solo at every dance competition starting from the time I was 10. When I couldn't swim anymore, that's when my life spiraled out of control.
Control is the most prominent factor in anorexia. They have an extreme need for control that affects every aspect of their life. Control for the anoretic is the basis of their perfectionism, their competitiveness, and their impressiveness. More than just perfectionism, though, shame is strongly associated with the anoretic's control. They evaluate the self, finding it flawed, developing low self-esteem, extreme self-criticism, and eventually self-hatred. They believe that if they can just rid themselves of that shame by controlling their weight and shape, they will be accepted by themselves and everyone else because everyone else does, in fact, love thinness.
The Western culture's excess value placed on thinness is an important factor in the drive for thinness. It leads to severe dieting in adolescence, the need for effortless perfection and social comparison of shape, weight, and size. The perfect girl does not need anything or anyone. She is in full control.
Family also plays a big role. Low paternal care makes the anoretic crave for attention. That starts with their excellence in all of their pursuits and turns into self-sufficient starvation. Also, familial concentration on perfection and value and beauty leads to self-criticism and need for self-control.
Once adolescence and puberty hit, the body is out of control, and anyone at risk for anorexia begins their control cycle of self-starvation. Developmental changes during puberty, along with stressful events, the excess value placed on thinness, and public criticism create the downward spiral from extreme dieting to a full-blown eating disorder. Anorexia is one of the hardest disorders to stop, even if the anoretic wants to, because of the strong psychological and biological effects.
Anorexia-Nervosa is maintained due to neural and endocrine dysfunctions. The brain is vulnerable to self-starvation because of its reliability on calories. Starvation shrinks the brain, causing behavioral and psychosocial dysfunctions like slow movement, emotional instability, social difficulties, and deficits in self-regulatory systems. These functional anomalies maintain disordered eating behaviors. Serotonin levels are also affected by starvation, which is aversive in that it affects the stress response. In this manner, Anoretics cannot respond well to stress, making stress levels out of control, leading to more need for control. Reproductive function and mood are also affected by serotonin, which accounts for amenorrhea and emotional instability. Abnormal serotonin levels account for many of the comorbidities like OCD and depression.
Anoretics quickly become obsessed with the compulsions of body checking. They excessively weigh themselves and feel parts of their bodies as a sense of control, a reinforcement of their self-control. Unfortunately, though, the rate of weight loss decreases as weight decreases. The anoretic sees this as a failure, and they do not fail. It will lead to more extreme measures to maintain weight loss, like excessive exercise.
Most importantly, eating disorders are maintained through a cyclic pattern derived from avoidance coping. Because of the anoretics' extreme emphasis on control, the ability to have enough self-control to restrict food is positively reinforced. They believe that controlling eating controls all things that are important in their lives. Restriction gives them a sense of success and a sense of control. It is their solution to unhappiness, reducing their negative effect. The control cycle and the shame-pride cycle go hand in hand in that restriction equates to pride and control, while hunger is perceived as shameful and out of control. The need to have control over this cycle makes it even more devastating to the anoretic. The extreme need for control and the biological consequences of starvation lead to a self-maintaining disorder that has little treatment successes.
Treatment for anorexia is difficult because of the numerous variable and unidentified causes. It comes from a medical, nutritional, social, and psychological base. The SSRI fluoxetine is somewhat beneficial but doesn't have an extreme benefits. The medical and nutritional basis of treatment are simply teaching the anoretic how to eat healthy. In order to immediately restore their weight, treatment care providers will give the patients multivitamins, Ensure, and feeding tubes.
A new approach to treatment used at the Duke Medical Center is called ACT, Acceptance and Commitment Therapy. The goal of ACT is to get the anoretic to accept their private experiences while living a valuable and meaningful life. It targets the need for control, personal values of the anoretic, and their commitment to valuing their values in their lives.
What was it like in the hospital?
One word: routine. The days are the same, precisely the same. Nothing ever changes. Life melts down to a simple progression of meals. But the feeding tube made it hard to sleep at night. And I got really sick of the Ensure, Gatorade, and Pedialytes if I didn't finish my meal. I liked when we went outside in the hot Arizona sunshine and rode horses. Those were the best days. I liked routine. It showed a sense of control. But it got to a point where I just wanted out. It was so hard, but it was so worth it. I knew that I would smile again, and that was overwhelming. A lot of changes were going on. A lot of changes I couldn't control. I knew I wanted to be healthy and be there for my friends and family again. But I didn't know how hard that was going to be.
The psychological aspects of treatment focus on self-control and self-acceptance. Cognitive behavioral therapy, where the problem eating behaviors and dysfunctional thoughts are both targeted, is shown to be more effective than strict nutritional therapy. Family therapy is also an aspect of CBT. It focuses on psychoeducation and restoring interpersonal relationships and communication within the family. One of the best eating disorder treatment facilities in the country is right here in Durham. The Carolina House uses a variety of treatment methods. The most prominent and most effective is dialectical behavior therapy. This approach addresses the development and strengthening of vital life skills such as mindfulness, emotion regulation, stress management, and interpersonal communication. The patients become aware of how their eating disorders undermine their values and negatively affect their lives in hopes to change their behavior. Because the Carolina House is an inpatient facility, it also includes more enjoyable therapy to change up the daily routine, like spiritual therapy, individual therapy, family, art, yoga, interpersonal, nutrition, culinary, body movement, and psychiatric care. The dynamic treatment approaches of the Carolina House make it one of the most sought after eating disorders clinics in the country. Regardless of research of effective treatments, treatment for anorexia has very poor prognosis. Between 10 to 65% of anoretics relapse within the first year out of treatment. 18% of anoretics die.
Some patients will simply eat their way out of treatment and relapse soon after release. Others flat out drop out of treatment because they were forced to go in the first place. The problems with their gastrointestinal functions result in bloating and discomfort after eating normal meals, leading to body dissatisfaction, low self-esteem, depression, and relapse.
Because the personality of the anoretic is unchangeable, shame and guilt and the need for control still remain as a part of her. If the control cycles continue, relapse is inevitable.
How are you doing now? I have my days. I wish I could see myself the way everyone else does. Sometimes it's hard to go out and cheer for the team knowing I'm going to be showing my stomach. But my friends and family have helped. They're not here, but they have helped a little bit. It never goes away. The thoughts and the struggles. But I'm trying. I want to be an example for others. I want to be myself again.
Anorexia is, at this time, impossible to cure and close to impossible to treat, making it a long, hard struggle for the rest of the anoretic's life. As Wasted says, it's never over, not really. You never come back, not all the way. Always there's an odd distance between you and the people you love and the people you meet, a barrier thin as the glass of a mirror. You never come all the way out of the mirror. You stand, for the rest of your life, with one foot in this world and one in another, where everything is upside down and backward and sad. The entirety of my life is overshadowed by one singular and near-fatal obsession. Anoretics are forever obsessed with control, obsessed with perfectionism, and obsessed with food.
My thighs are an epidemic and they're taking over the world.
It's a diet diary. We write down every morsel that goes into our